Hello, and thank you for your interest in our research. I would like to thank my colleagues Wenli Chen, Stephanie Cotton, and David Lott, who collaborated with me on this research. Instrumentalists have been known to have various disorders in head and neck regions. Incidence of hearing disorders, temporomandibular joint disorders, lip disorders, and speech disorders, as well as orofacial changes and dental changes over the course of the years. Several investigators have also reported voice problems in woodwind players who are also singers. Breathing difficulties trying to sing softly, pneumoperitonitis, singing fatigue after playing have all been reported in the literature. Mieth and Gilbert have suggested that increased oral pressures, modified breathing techniques, and/or facial postures of woodwind players may influence changes in a singer's normal breathing and thus affect voice production. Gallivan and colleagues published a case of a 23-year-old soprano who developed a vocal fold polyp and reported loss of her high range, throat problems, effortful phonation, and dysphonia during speaking and singing. The vocal polyp was subsequently removed and her voice improved. Previously, we have used rigid endoscopy and high-speed video to study the vocal folds. All of our findings have been with rigid endoscopy up till now. Recent studies with flexible endoscope and high-speed video have allowed us to further investigate vibratory motion of vocal folds using natural speech. The purposes of this study were to establish the use of a flexible high-speed video recording system with synchronized audio recordings to capture laryngeal behavior during playing a clarinet. A second purpose was to compare the vocal postures of woodwind players who also sing during playing and phonating. We used a special camera, a Vision Research Photon V1212 camera equipped with an Olympus flexible endoscope and a 300-watt xenon light. The frame rate was approximately 4,000 frames a second. Each recording that we did took 60 seconds, and then it took about 80 seconds for it to go to our host storage. We also used a Bruin-Cara microphone. This slide shows a picture of a patient, a young lady with normal voice who plays the clarinet, being ready to be recorded. A close-up of the camera is shown on the right side of the slide. On this slide, we show a subject with previous data showing the voice onset and gesture delay. As we pointed out, and from Wu's data, we also see that there is a prephonatory delay followed by a steady state delay, followed by vocal fold vibration. In the clarinet player, we see that the chymogram on the right side is indicating motion of the vocal folds, and there is a pre-playing delay along with a steady state delay. However, the vocal folds never approximate. Here is the video along with the clarinet sound that was used. And as we see, there is inhalation by the clarinet player, followed by a slight adductory motion, which we will see here in a second. The false chords coming together with the vocal folds coming together, and finally anterior-posterior approximation to some degree, along with now vocal fold vibration. Maybe a little bit hard to see on this slide, but I wanted to get the full anterior-posterior dimension. The chymogram on the right shows the vocal folds And as we can see, there is a motion on the vocal folds. Our preliminary observations from the study of 2 subjects showed that during the onset gesture, there is minor motion of the false vocal folds, both lateral and anteroposterior. Adductory motion stops abruptly with no complete closure, and there is then limited anterior-posterior squeeze. During playing, there is minimal vocal fold vibratory motion. After the offset, the false vocal folds return, first the anterior-posterior dimension and then laterally, and finally the vocal folds. Of note, the false vocal folds assume the playing position rather abruptly. The true vocal folds adduct to a fixed position when playing begins. Vocal fold vibration is seen during the entire playing. This differs from phonation in that the prephonatory vocal fold posture stops abruptly. Similar to phonation is the fact that the vocal folds were vibrating, although without complete closure. Here is a sample of the same subject who then produced that same sample vocally, and as we can see, the vocal folds vibrating without difficulty. In conclusion, we find that high-speed flexible video captures the precise vibratory onset in laryngeal movements during normal phonation and during playing the clarinet. There are improvements to be made in the visual picture, of course. Vocal folds show vibration at the steady state delay posture during clarinet playing. Voice onset gesture found in clarinet playing may offer evidence of fatigue that has been observed in clarinet players who sing. Our future work will allow us to examine the degree of vibratory changes following clarinet playing and maybe other instruments as well. We would like to compare the before versus after phonation in these subjects as well. We hope to replicate current studies with larger samples and compare playing onset in musicians who experience voice complaints. We also want to identify vocal fold onset patterns when playing different instruments. And finally, we want to use this technology to explore applications of high-speed flexible video in the study of voice disorders. I'd like to thank you for your interest in our work, and I would like to thank my colleagues, Peek Wu, Wenli Chen, Stephanie Cotton, and David Lott for the opportunity to work with high-speed video. Thank you.